when we're measuring someone's kidney function, there are certain calculations, and someone's race is built into those calculations. So for Black people, there's a different calculation and a different kidney function that will result. And we found that this shouldn't be the case, so race shouldn't be included. But essentially what's happened is that Black people are being treated differently. Their kidney function is being measured differently, which results in misdiagnosis of chronic kidney disease, different access to dialysis, for example, based on this very simple calculation that's built into the guidelines and the systems that we use.
A new study by the health journal The Lancet finds racial inequalities and deeply embedded prejudices can mean significantly poorer life opportunities and health outcomes for minority groups across the world. Well, we can speak now to Professor Delan Devakumar, who is from University College London and is the lead author of the study. Good morning.
Hi, thank you for having me.
No, it's a pleasure. Please just explain to us, first of all, how racism, how discrimination plays into the healthcare that people receive, not just in this country, but around the world.
Sure. So one of the things we tried to do with the series was to look at healthcare across the world. And what we see is that there are similar causes and consequences related to racism, to xenophobia, to discrimination. And this has been relatively ignored by the health profession. We deal with some of the consequences on a day-to-day basis, but we don't think about what happens upstream. This could be related to individual acts of violence, verbal abuse leading to mental health conditions, or it could be much more systemic, thinking about what happens within the health system. So particular groups being marginalized, being ignored, being treated differently, having different access to the health system. And this happens in every society around the world. We see migrants, for example, who might be excluded from the health system. We see people from different castes in South Asia having different access to the health system. And this results in poorer health outcomes for those people. And in the worst case, people dying early. And particularly stark example was in the COVID-19 pandemic, where we saw much higher rates of mortality amongst people from minority ethnic groups in the UK. So I think that sort of covers in a nutshell what we tried to look at.
So can you give us some specific examples that people shared with you, their own personal experiences? What happened to them?
So there are specific examples. So I don't work currently in the NHS. I used to work as a clinical pediatrician, but not anymore. Now I'm based in the university. And I think what we find is that there are different levels of access. So in the NHS, for example, we have a system that is free at the point of access, so somebody doesn't have to pay. But certain groups, that's not the case. So if we think about migrants, for example, if a migrant child has to get care in hospital, and I'm sitting here with Great Ormond Street Hospital right behind me, those children have to pay, which leads to those children and their parents coming to hospital late with the more severe infection. And we see sometimes parents are worried about going to the hospital because their data might be shared with Home Office, for example. So we see these barriers to access, which leads to poorer health. In my case, looking particularly at children. Some work we did was looking at undocumented children within the UK. So there are approximately 120,000 undocumented migrant children, around half of whom are actually born in the UK. And those children don't have the same levels of care that other children do. So if they were to go to the hospital, they get charged for going to the hospital. And these children present late. There are also cultural barriers that people may not understand the health system. And I find, even as a medical doctor, it's sometimes difficult to know where you're meant to go, how you're meant to get into the health system. And some of those barriers we saw within COVID-19, we've seen different levels of vaccination amongst different groups, for example. We've seen different levels of care amongst different groups. And those have very real consequences for the people involved.
When we're talking about levels of care, are we talking at a really basic level of racism, that if a white person presents with the same illness, condition, whatever, as a non-white person, would they receive different care because of assumptions and racism?
So this may happen, and there is racism within health system, as there is within any system, I should say. So this is about society in general. But I think what we're trying to look at are these systems that are in place. So we talk about chronic kidney disease as an example. So within the UK, within the US, certain countries, what we have is when we're measuring someone's kidney function, there are certain calculations, and someone's race is built into those calculations. So for Black people, there's a different calculation and a different kidney function that will result. And we found that this shouldn't be the case, so race shouldn't be included. But essentially what's happened is that Black people are being treated differently. Their kidney function is being measured differently, which results in misdiagnosis of chronic kidney disease, different access to dialysis, for example, based on this very simple calculation that's built into the guidelines and the systems that we use. And recently within the UK, that's been changed, but this practice is still happening in places, and it's still very slow to change. So that's an example where the system can be racist, even if the individuals treating patients are not.
Just seems bizarre. You wonder why that was ever even there in the first place. How difficult is it to unpick all of these kind of issues? And I'm not just thinking here about in the UK, but across the world. It sounds like it's challenging and will take time.
Oh, absolutely. And I think you ask a very good question there. Why does this happen? I think there's this false idea of people being different. And really, as a human race, we are very similar genetically, more than any other species. But what we have is these racial categories that are social categories. They're not biological categories. But people apply different meanings to them. So we have this situation like with kidney disease, which are not real, but these social categories people think are different. But we do see differences in outcomes, and that's related to racism. It's related to how people are treated. And this happens around the world. We see based on indigenous status, based on caste, based on religion, we see people who are discriminated in every society, everywhere around the world.